Hey guys, this is Dr. Patel with Harmony Oral and Facial Surgery. I'm a board-certified oral and maxillofacial surgeon. So one topic we're going to talk about today that most people have heard of, either have done to themselves or to others, is dry socket. So some people develop something called dry socket after they have their teeth out. Why does this happen and what can you do to prevent it? Or what can you do to take care of it after it happens? So dry socket, first of all, is something that can develop after a tooth is removed. The chances are higher if it's a surgical extraction or if the person or the provider removing the tooth is inexperienced, or it took a long time to take the tooth out, or if you're someone who's taking multiple medications, if you're a woman taking oral contraceptives such as birth control, or if you're a smoker, there's a high chance that you can get dry socket. Okay, what exactly is dry socket? The scientific term, the medical term for it is alveolar osteitis, meaning it's essentially dry bone. What happens is that the blood clot either doesn't form there, so you can, when you look into it, you're looking directly at the bone, or it gets broken down pretty quickly, either by your body or by the bacteria in the area. So what can you do to prevent that? Well, one, if you're a smoker, you can quit smoking, okay? However, we do advise after extractions that you prevent or you don't spit vigorously. So when you swish your mouth, you just let the water out. And you don't drink through a straw because it can cause negative pressure and cause the blood clot to dislodge. Okay, so those are the things that you can do to prevent a dry socket. What can you do if it does happen? Well, usually the signs and symptoms present themselves this way. Usually you're doing okay after surgery. However, day 3 comes around and you start feeling increased pain that's radiating to your ears, to your jaw. Sometimes that could also be a sign of a bigger infection. However, a dry socket will not have swelling associated with it. By day 3, your swelling should start coming down, okay? So dry socket usually is very, very high pain. Most people report it 8 to 10 out of 10. And you will have no relief by taking anything really. So this is something you want to see your provider for. Normally, we'll put a medicated paste, we'll rinse out the area, and we'll have some sort of medication that we'll put in there. It has essential oils like clove oil that helps soothe the area. However, your body will still have to do its own healing over time. So it's not something that can magically disappear over time. It does take some time to heal. But hopefully this helps clarify what dry socket is, how to avoid it, and what to do if you do get it. Thank you for following my channel. For more information, please subscribe and help spread the word. Thank you. Until then, goodbye.